So early diagnosis for TB is really important. So there's several things that they can do to diagnose the infection. Probably the most common and the easiest is the MAN2 test, where they put a small protein from Mycobacterium tuberculosis in the arm, and then you go back several days later and they measure the amount of swelling and redness that you're experiencing. In response to Mycobacterium tuberculosis, if we have it, our body has a very strong immune response, which generates a large amount of inflammation and reddening at the wound site. So they would essentially just measure that, and if you had a certain degree of redness and swelling, that would indicate that you are TB positive, and then you would likely get a chest x-ray to follow up. It is important to note that if you've ever had the TB vaccine, which is not a vaccine that we use in the United States, but if you were born in another country, you may be vaccinated, you would test positive in the MAN2 test. And it's not that you have tuberculosis, it's that you have immunity towards tuberculosis, and that is what's still generating the response and causing the redness and swelling. So if you have to get the MAN2 test and you know you've been vaccinated for tuberculosis when you were a child, being born in another country, you want to make sure that you have proof of vaccination records. Nowadays, they can also do a blood test, quantiferon, which is a bit more expensive, but it can also be used to positively diagnose Mycobacterium tuberculosis. And then also they can do x-rays, but these are typically to confirm a positive result. So if your blood work or your MAN2 test would come back positive, then they would do a chest x-ray to confirm. And for that, again, they're looking for those tubercles. They're looking for those little nodules there in the lungs. As we've seen in a previous lesson, we can use acid-fast staining to diagnose tuberculosis, but for this to work, the patient would have to have active TB. We would have to collect a mucus sample from them, and then we would have to subject it to an acid-fast stain. And if it comes back pink, which is positive, that's an indicator that the individual has an infection with Mycobacterium, and then a chest x-ray would usually be done to confirm. So as far as prevention, in other countries, they do use a vaccine known as the BCG vaccine. There is some health risk associated with that vaccine, so we do not use it in the United States. It is made with a living but weakened version of the bacteria, which can be problematic in some individuals, especially those individuals that are immunocompromised and potentially cause an infection. So it's not used in the United States. In the United States, we prevent through limited exposure. So we obviously routinely check healthcare workers that would be exposed to Mycobacterium tuberculosis to make sure they're negative. If a patient does have active TB, they are quarantined. So it is just limited through exposure, and then obviously just testing healthcare workers that would be first to be exposed to make sure they stay negative. As far as treatment, fortunately, while it can be dangerous, Mycobacterium tuberculosis is responsive to antibiotics, so you can treat it through the use of antibiotics. So regardless of whether you have latent or active TB, you need to have it treated. Latent TB, typically you're on antibiotics for 6 to 9 months. I don't need you to know specific antibiotics because sometimes these things can change based on resistance, but isoniazid has been a standard for Mycobacterium tuberculosis for years and years. So with latent TB, you would just be on a daily dose of isoniazid for 6 to 9 months. Active TB, you do have to be on various other antibiotics, including isoniazid, for a longer period of time, 6 to 12 months. So it's definitely an extensive treatment plan when we compare it to a normal antibiotic course, which would be 7 to 10 days. Because you have to be on antibiotics for such a long period of time to clear the infection, there is a lot of patient noncompliance. So patients may go on the antibiotics for a short period of time and then start to feel better, so they go off the antibiotics, or if they have dormant TB, they never felt sick in the first place, so they may kind of slack on taking their antibiotics. And we know if you go on and off antibiotics, or if you don't use them appropriately, bacteria can become resistant to the antibiotics. So there are strains of resistant TB circulating around, and some of these strains can be quite dangerous as they're not responsive to antibiotics. So if you get infected with one of these strains, it can either be incredibly hard to treat or even completely not able to be completed. So patient noncompliance really has contributed to antibiotic resistance because these patients have to be on antibiotics for such a long period of time. This is a good video for you to look at. This just kind of summarizes everything we talked about as far as how TB progresses in the body, and then going through diagnosis and treatment as well. So the next disease is pneumonia, which is more of a condition. Pneumonia is basically an inflammatory response where fluid builds within the alveoli of the lungs. Typically, when we have an infection, our body releases chemicals such as histamine that allow for vasodilation so that more blood can get to the infected site because the blood's going to have immune cells in it to fight the infection. But we also know that those blood vessels will become leaky or permeable, and that allows the fluid to leak into the tissue. And again, that's generally a good thing because the fluid has immune cells that are going to help fight the infection. However, this process can become problematic when fluid starts to build up in the lungs. And the fluid's there because it has immune cells and it's trying to clear the infection. But when fluid's building up in the lungs, it can prevent oxygen exchange within the alveoli. So the fluid's good and it's really bad at the same time. So there's not just one specific causative agent of pneumonia. Really all different types of viruses like COVID and influenza and RSV can cause pneumonia, and also different types of bacteria such as Streptococcus pneumoniae. Really, the microorganism just has to have the ability to get in the lower respiratory system. Once it's in the lower respiratory system, our body is going to induce inflammation to try to clear it, and when that happens, fluid is going to leak into the lung tissue and lead to a case of pneumonia. So the bacteria or virus just has to have the ability to survive. For example, Streptococcus pneumoniae has a capsule on it. So when it gets into the lung tissue, the alveolar macrophages that would typically engulf bacteria and destroy them are not able to work. So the bacteria is able to stay. Our body induces inflammation. Fluid fills up in the lungs, and the patient gets pneumonia. Pneumonia is typically transmitted through droplet transmission, so someone that has the disease is going to be coughing, and in their mucus droplets, the virus or bacteria would be found and transmitted to another host. The symptoms are going to be obviously a cough. It will be a productive cough because you are going to be coughing up the mucus. This cough is actually really important. You don't typically want to suppress a cough in someone that has pneumonia other than to just help them sleep at night. Throughout the day, you actually want to encourage frequent coughing to help kind of work up that fluid. Obviously, they would need to be put on medication like antibiotics or antivirals to kill the microorganism that's causing the infection. But then also coughing up this fluid at the same time is going to clear out that fluid from the alveoli and allow for that gas exchange to happen and oxygen to get back in. Chest pain, because of the fluid of the accumulation, is quite common. Shortness of breath, again, that fluid is blocking oxygen exchange, so you have to kind of work harder to get more oxygen in, so you can be very short of breath. Because you have an infection, you'll likely be fatigued and have a fever, confusion typically from lack of oxygen to the brain. Complications, respiratory failure. This fluid is blocking the alveoli from doing their job, which is oxygen exchange. So you can very easily go into respiratory failure and need to be put on a ventilator. The bacteria can also exit through the alveoli, the blood vessels in the alveoli. They can get into the blood, and at that point, once they're in the blood, they can cause a patient to become septic, which would mean that their blood pressure would drop, and they'd no longer be able to get oxygenated blood to their organs and tissues, which could cause the patient to go into a coma. And then lung abscesses, so the bacteria can create abscesses within the lungs, which ultimately are infectious pockets within the lungs. That also could cause the bacteria to get into the blood supply as well and cause sepsis. So as far as diagnosis, it's pretty straightforward, as chest x-rays are typically done. So in the chest x-ray, if someone had pneumonia, what you would see would be this kind of cloudiness. In someone that's healthy, this would be nice and clear in here. But all this cloudiness that we see throughout here is fluid that's accumulating in the lungs. So chest x-rays are used to diagnose. Treatment, it depends on what's causing the pneumonia. I mean, if you have pneumonia induced from COVID, then you probably need antiviral treatment. If it's from Streptococcus pneumoniae, which is a bacteria, you need antibiotics. Some individuals will just need bed rest in addition to the antibiotics or antivirals, whereas other individuals that have a more severe case might need oxygen therapy and to be put on a ventilator. As far as prevention, we have various vaccines that can protect you against different causative agents of pneumonia. So, for example, influenza-based pneumonia can be prevented by getting your flu vaccination every year. We have pneumococcal vaccines that can protect you against pneumonia caused by Streptococcus pneumoniae. Even the COVID-19 vaccines can protect against pneumonia induced by the SARS-CoV-2 virus. So we have vaccines that can protect us against several different causative agents. There is also healthcare-associated pneumonia, which is basically just pneumonia that's acquired in a healthcare facility. So someone comes into the hospital because they are ill, whether it be cancer, diabetes, whatever it be, and then while they're at the hospital, they get a case of pneumonia, whether it's picked up from another patient or through aspiration or from a contaminated respiratory equipment. If they get pneumonia while they're at the medical facility, it's healthcare associated or healthcare acquired pneumonia. These are just some causative agents that are commonly found in a medical setting that can cause it. I don't need you to memorize these specifically, but these are present. As far as healthcare associated or healthcare acquired pneumonia, the most common ways to get it in a medical facility are through aspiration pneumonia. So essentially this is choking on one's vomit, where bacteria from the gastrointestinal system can get into the respiratory system and cause pneumonia there. And then also contaminated ventilation equipment too. If that is utilized on someone, it can inoculate bacteria into their lower respiratory system and cause pneumonia. There are things that we can do to prevent this from happening. Elevating a patient's head cuts down on the chance that they would aspirate, so it basically just prevents choking. So just putting a pillow under their head or even rolling them to the side is helpful. You don't want to leave them laying on their back, because if they would vomit, they would obviously choke on it and could get aspiration pneumonia. Educating patients about the importance of frequent coughing and kind of working up that fluid, and also deep breathing is helpful. Making sure to properly care for any respiratory equipment, because we don't want to use that equipment to treat someone, because we'd essentially inoculate bacteria into an immunocompromised individual. And then empiric therapy is in therapy based on an educated guess and experience. So with pneumonia, it needs to be treated ASAP, because it can progress really fast, especially if someone's immunocompromised, and in a healthcare acquired pneumonia, they likely are, because they're sick, they're at the hospital for a reason. So if this patient comes in, you may not do if they're showing symptoms of pneumonia, you would treat them right away with maybe a broad spectrum antibiotic, get them on something, and then you can do all the diagnostic tests to figure out exactly what's causing it and switch up the medication if you need to, but you want to get something in their system right away to start fighting it.